Hey there, welcome back to the channel. I'm Dr. Tasuku Honjo, and before you click away, let me ask you something. Have you noticed that your legs feel heavy by the end of the day? Maybe you've got that uncomfortable tingling sensation that just won't go away, or perhaps you've seen those unsightly spider veins creeping up your calves. You might have tried magnesium supplements because everyone talks about magnesium for circulation, right? But what if I told you that there's another vitamin that's actually far more critical for leg circulation in seniors, and almost nobody is talking about it? What if the solution to better blood flow, reduced leg pain, and healthier veins has been hiding in plain sight this entire time? Stay with me because today I'm going to reveal the #1 vitamin for seniors' leg circulation. And trust me, this is information that could literally change your life or the life of someone you love. Now, I know what you're thinking. Another video about vitamins, another miracle cure, right? But hear me out, because what I'm about to share with you is backed by solid science, and I've seen the results firsthand in my own practice. Before we dive into what this vitamin is, I want you to understand why leg circulation becomes such a massive problem as we age, because once you understand the mechanism, everything else is going to make perfect sense. You see, as we get older, our blood vessels start to lose their elasticity. Think of them like old rubber bands that have been sitting in a drawer for years. They don't snap back the way they used to. The walls of our veins become less flexible, and this is especially problematic in our legs because blood has to fight against gravity to make its way back up to the heart. On top of that, the tiny valves inside our veins that are supposed to prevent blood from flowing backward, they start to weaken. When these valves don't work properly, blood begins to pool in the lower extremities. This is why so many seniors experience swelling in their ankles and feet, why they get those tired, achy legs, and why some develop varicose veins or even more serious conditions. But here's where it gets really interesting. Most people, including many healthcare providers, immediately jump to magnesium when talking about circulation. And look, I'm not saying magnesium isn't important. It absolutely is. Magnesium helps with muscle function, it supports cardiovascular health, and yes, it does play a role in circulation. But magnesium is not the master key when it comes to leg circulation specifically, especially for seniors. The vitamin I'm talking about today works on a completely different level, and its impact on vascular health is honestly remarkable. So what is this mystery vitamin? It's vitamin K2. Now, before you say, wait, I've never even heard of that, or isn't that the same as vitamin K, let me explain why vitamin K2 is an absolute game changer for leg circulation and why it's criminally underrated in the health and wellness space. First, let's clarify something. There are actually two main forms of vitamin K. There's vitamin K1, which you get primarily from leafy green vegetables, and there's vitamin K2, which is a completely different animal. Vitamin K1 is mainly involved in blood clotting. Your body needs it to make sure you don't bleed excessively when you get a cut. Vitamin K2, on the other hand, has a much more sophisticated job. It's responsible for directing calcium to the right places in your body and keeping it away from the wrong places. And this is absolutely crucial for vascular health. Let me paint you a picture of what happens when you don't have enough vitamin K2. Without adequate K2, calcium that you consume, whether from food or supplements, doesn't get properly directed to your bones where you need it. Instead, it starts to deposit in your soft tissues, and that includes your blood vessels. This process is called arterial calcification, and it's one of the primary reasons why blood vessels become stiff and rigid as we age. When your arteries and veins are calcified, they can't expand and contract the way they're supposed to. Blood flow becomes restricted. Your heart has to work harder to push blood through these narrowed, rigid vessels, and nowhere is this more noticeable than in your legs. Think about it. Your legs are the furthest point from your heart. They're already fighting an uphill battle against gravity. Now add calcified, rigid blood vessels into the mix, and you've got a recipe for poor circulation. This is why so many seniors struggle with cold feet, numbness, cramping, and that heavy, tired feeling in their legs. Their blood vessels have literally become too stiff to do their job efficiently. But here's the amazing thing about vitamin K2. It activates certain proteins in your body, specifically a protein called matrix GLA protein, which acts like a calcium traffic cop. It grabs calcium from your arteries and blood vessels where it doesn't belong and helps shuttle it to your bones and teeth where you actually need it. Studies have shown that vitamin K2 can actually reverse arterial calcification. Let me say that again because it's important. We're not just talking about preventing further damage. Vitamin K2 can actually help reverse the stiffening of your blood vessels that's already occurred. There was a groundbreaking study published in the journal Thrombosis and Hemostasis that followed postmenopausal women for 3 years. The women who supplemented with vitamin K2 showed significantly reduced arterial stiffness compared to the control group. Another study in the Rotterdam study, which followed over 4,000 people for 7 years, found that those with the highest intake of vitamin K2 had a 50% reduced risk of arterial calcification and a 57% lower risk of dying from heart disease. These aren't small numbers we're talking about. This is substantial, life-changing stuff. Now you might be wondering, okay, if vitamin K2 is so important, why isn't everyone talking about it? Why did my doctor never mention this? Well, here's the thing. Vitamin K2 research is relatively newer compared to other vitamins. It's only in the last couple of decades that we've really begun to understand just how critical it is for vascular health. Plus, there's a widespread deficiency of vitamin K2 in Western populations, and most people don't even know it. Unlike vitamin K1, which is abundant in green vegetables, vitamin K2 is found in much smaller amounts and in very specific foods that most people don't eat regularly. So where do you get vitamin K2? The richest source by far is a Japanese food called natto, which is fermented soybeans. Now, I've got to be honest with you. Natto is an acquired taste. It's sticky, it's pungent, and most people outside of Japan find it pretty unpalatable. But if you can stomach it, just one serving of natto gives you more vitamin K2 than most people get in an entire week. Other sources include grass-fed butter, certain cheeses like Gouda and Brie, egg yolks from pasture-raised chickens, and organ meats like liver. Notice a pattern here? These are all animal-based foods, and many of them are foods that people have been told to avoid because of cholesterol concerns. This is part of why so many seniors are deficient in K2. They've been eating low-fat diets, avoiding egg yolks, skipping the butter, and as a result, they're missing out on this critical nutrient. Now, I want to be very clear about something. I'm not suggesting that you go out and start eating sticks of butter or that you ignore heart-healthy eating. What I am saying is that moderate amounts of these traditional, nutrient-dense foods can be incredibly beneficial, especially when it comes to getting adequate vitamin K2. And if you're not able to get enough from food, supplementation is absolutely a viable and effective option. When it comes to supplements, you want to look for vitamin K2 in the MK7 form. There's also an MK4 form, but MK7 has a much longer half-life in the body, which means it stays active longer and you don't need to take it as frequently. A typical effective dose is between 100 and 200 micrograms per day. Some studies have used even higher doses, up to 360 micrograms, with excellent results and no adverse effects. The beautiful thing about vitamin K2 is that it's incredibly safe. Unlike some vitamins that can be toxic at high doses, vitamin K2 has no known toxicity level. However, and this is important, if you're taking blood-thinning medications like warfarin or Coumadin, you need to talk to your doctor before supplementing with any form of vitamin K. These medications work by interfering with vitamin K's role in blood clotting, so adding more vitamin K can affect how well your medication works. Your doctor might need to adjust your dosage, or you might need to maintain a consistent intake of vitamin K so your medication can be properly calibrated. Just don't start supplementing on your own if you're on blood thinners. Now let's talk about what you can actually expect when you start getting adequate vitamin K2. This isn't a magic pill where you take it once and suddenly your legs feel amazing. Remember, we're working on reversing years or even decades of arterial calcification and improving the fundamental health of your vascular system. But over time, typically within a few weeks to a few months, many people notice some pretty significant changes. that heavy, tired feeling in the legs starts to diminish. The nighttime leg cramps that have been plaguing you might become less frequent or disappear entirely. Your feet might not feel as cold, the swelling in your ankles might go down, and if you were to measure your arterial stiffness with specialized medical equipment, you'd likely see objective improvements there as well. I had a patient, let me tell you about her. She was 73 years old and she came to me complaining about severe leg pain, especially when she walked. She couldn't make it more than a block without having to stop and rest. Her legs would ache, they'd feel heavy, and she was convinced she was just getting old and there was nothing to be done about it. Her previous doctor had recommended magnesium, which she tried, but it didn't make much difference. I ran some tests and found that she had significant arterial stiffness. I put her on a vitamin K2 supplement, along with some other supportive nutrients, which I'll tell you about in a minute, and within about 6 weeks, she reported that she could walk much farther without pain. Within 3 months, she was walking a mile comfortably. Her leg pain had diminished by about 70%. That's the power of addressing the root cause rather than just treating symptoms. Now, vitamin K2 works even better when it's paired with certain other nutrients. It has a synergistic relationship with vitamin D3, for instance. Vitamin D helps your body absorb calcium from your food, while vitamin K2 makes sure that calcium goes to the right places. If you're taking vitamin D supplements, which many seniors are because vitamin D deficiency is extremely common, you absolutely should be taking K2 alongside it. Otherwise, you're potentially increasing calcium absorption without the proper mechanism to direct that calcium away from your arteries. This is actually one of the theories about why some studies have shown increased cardiovascular events in people taking high-dose vitamin D without K2. Magnesium actually does play a supporting role here as well. While it's not the star of the show for leg circulation, magnesium is necessary for vitamin K2 to work properly. It's a cofactor in several of the enzymatic reactions that activate those calcium-regulating proteins I mentioned earlier. So, a comprehensive approach would include vitamin K2 as your primary intervention for leg circulation, supported by adequate vitamin D3 and magnesium, along with other vascular supportive nutrients like vitamin C and omega-3 fatty acids. Let's also talk about lifestyle factors because I don't want you to think that you can just take a supplement and ignore everything else. Improving leg circulation requires a multifaceted approach. Regular movement is absolutely critical. When you walk, when you move your legs, the muscle contractions actually help squeeze blood back up toward your heart. This is called the muscle pump mechanism, and it's one of the primary ways your body fights against gravity to return blood from your legs. Even if it's just 10 minutes of walking 3 times a day, that movement is crucial. If you have mobility limitations, ankle pumps and leg lifts while sitting can also help. Elevating your legs when you're resting is another simple but effective strategy. When you're sitting on the couch watching TV, prop your legs up on some pillows so they're above the level of your heart. This reduces the work your veins have to do and allows blood to flow back more easily. Compression stockings can also be incredibly helpful for many people. They provide graduated pressure that's tighter at the ankle and gradually decreases as you move up the leg, which helps push blood upward. Staying hydrated is more important than most people realize. When you're dehydrated, your blood becomes thicker and more viscous, which makes it harder to pump through your vessels, especially those narrow capillaries in your legs. Aim for at least 8 glasses of water a day, more if you're active or if it's hot outside. And I'm talking about water, not coffee or soda. Those don't count. Also, and I know this is a tough one for some people, but reducing or eliminating smoking is absolutely critical. Smoking damages the endothelial lining of your blood vessels, promotes inflammation, and significantly worsens circulation. If you smoke and you're experiencing leg circulation problems, quitting is probably the single most impactful thing you can do besides getting your nutrients in order. Let's circle back to the science for a moment because I want you to understand that this isn't just my opinion or anecdotal evidence. The research on vitamin K2 and vascular health is robust and growing. There have been multiple studies showing that vitamin K2 supplementation reduces arterial stiffness, decreases calcium buildup in arteries, and improves overall cardiovascular outcomes. The mechanism is well understood. We know exactly how it works at the cellular and molecular level. This isn't some unproven theory. This is solid, peer-reviewed science. One study published in Blood Purification looked specifically at patients with chronic kidney disease who tend to have severe vascular calcification. The patients who received vitamin K2 supplementation showed significant reductions in arterial stiffness compared to those who didn't. Another study in atherosclerosis followed healthy postmenopausal women and found that those who took vitamin K2 had better arterial flexibility and less calcification after 3 years of supplementation. What's particularly exciting is that researchers are now looking at vitamin K2 not just as a preventive measure, but as a potential treatment for existing vascular disease. The idea that we can actually reverse damage that's already been done, that we can make our blood vessels younger and more flexible even in our senior years, that's revolutionary. For so long, the message has been that vascular aging is inevitable, that stiff arteries are just part of getting older. But the research on vitamin K2 suggests that this doesn't have to be the case. I also want to address something that comes up a lot. People ask me, if vitamin K2 is so important, why don't I just eat more leafy greens? Won't that give me vitamin K? Well, as I mentioned earlier, leafy greens give you vitamin K1, not K2. Your body can convert a small amount of K1 to K2, but this conversion is very inefficient, especially as we age. Studies suggest that less than 10% of K1 gets converted to K2, and some research indicates it might be even less than that. So while you should absolutely eat your leafy greens for all the other benefits they provide, you can't rely on them for vitamin K2. You need to get K2 from fermented foods, animal products, or supplements. Another question I get is whether you can have too much vitamin K2. As I mentioned, there's no known toxicity level for K2. The research has used doses ranging from 45 micrograms all the way up to nearly 1,000 micrograms per day without any adverse effects. That said, more isn't always better. The sweet spot seems to be in that 100 to 300 microgram range for most people. There's no benefit to megadosing beyond that. Now I want to take a moment to talk about realistic expectations. If you've been dealing with poor leg circulation for years, if you have significant varicose veins, or if you've been diagnosed with peripheral artery disease, vitamin K2 is not going to cure everything overnight. It's an important piece of the puzzle, possibly the most important piece, but it's still just one piece. You may need additional medical interventions. You should absolutely work with your healthcare provider to develop a comprehensive treatment plan. What vitamin K2 can do is improve the underlying health of your vascular system, reduce further calcification, potentially reverse some of the damage that's already occurred, and support better overall circulation. These are significant benefits, but they work best as part of an overall approach to vascular health. I also want to emphasize the importance of getting properly evaluated if you're having significant circulation problems. Leg pain, especially pain that comes on with walking and is relieved by rest, can be a sign of peripheral artery disease, which is a serious condition that needs medical attention. While vitamin K2 can support vascular health, you shouldn't use it as a replacement for proper medical care. Think of it as a powerful tool in your toolkit, but make sure you're working with a qualified healthcare provider who can see the whole picture. So let me bring this all together for you. If you're a senior experiencing leg circulation problems, tired and heavy legs, cold feet, swelling, cramping, or if you're simply interested in preventing these issues as you age, vitamin K2 should be at the top of your list. Not magnesium, although magnesium has its place. Not any other supplement or vitamin. Vitamin K2 is the master regulator of calcium metabolism, and by keeping calcium in your bones and out of your blood vessels, it maintains the flexibility and health of your vascular system. This translates directly to better circulation, especially in your legs, where circulation is most challenged. You can get vitamin K2 from foods like natto, grass-fed dairy, egg yolks, and certain fermented foods, or you can supplement with the MK7 form at doses of 100 to 200 micrograms per day. Pair it with vitamin D3 and magnesium for optimal results. Stay active, stay hydrated, and give it time to work. You're reversing years of damage, so be patient. But also be encouraged, because the science tells us that real improvement is absolutely possible. I hope this video has opened your eyes to the critical importance of vitamin K2 for leg circulation and vascular health overall. If you found this information valuable, please give this video a thumbs up, share it with someone who might benefit from it, and subscribe to the channel if you haven't already. I'm Dr. Tasuku Honjo, and I'm here to bring you science-based, practical health information that can genuinely improve your quality of life. Drop a comment below and let me know if you've experienced circulation problems and whether you're going to give vitamin K2 a try. I read all the comments and I love hearing from you. Until next time, take care of yourself and take care of those legs. They've carried you this far, they deserve some support. I'll see you in the next video.